The results have been separated into two different areas. The micro results, which were the indication of the premium content that we analysed amongst all different people in different categories. And then the macro results, which were those which indicate the health of the scheme. So how healthy is your scheme, how sustainable is it, and how long is it likely to live, the longevity of the scheme. We put that together, so we looked at the macro results, and then we combined them. And what we found this year, which was quite surprising, was that Discovery came out tops, as opposed to last year where they came out only in 7th position, indicating that they are the healthiest scheme that's out there at the moment. A great growth since last year. Last year they came in 7th place, this year they came out on the top. I'd say that it's more to do with the other schemes becoming maybe not performing quite as well, more than what Discovery performing at its best, because it still has areas in which it can grow and become better. So the most amazing finding this year was that had made a great change. It had grown quite a lot. Our combination rankings still came out in high, medium and low, so we still showed how likely it is that GTC is going to support this company, or is it a medium likelihood or a very low likelihood that we would support that particular scheme in one of the 11 categories. From a GTC point of view, we would then market this product to our companies. So our clients, either individual members or groups, we mostly work with groups. So we would then market this product to our group companies. So we would take our companies, they would come to us, whether it's existing clients or new clients, and they would say, could you review our scheme? So we will have a look at the schemes in total in the different sectors that the company might belong to, and have a look at the ratings. Is there a high likelihood, a medium or a low likelihood that we would even support the company that the client has got, the medical scheme that they belong to, or whether we would recommend that they move or stay where they are based on the basics of our findings. After we've looked at that, whether it's a high, medium or low, so there might be 5 people in the high sector, we would then analyse all 5 of those and compare it with the client and decide if those benefits that match those premiums and macro overview are what's best for the client, and give a presentation to the client based on the results that we found. So likelihood of support indicates whether we would include those in our greater investigation report. Some of the smaller schemes on the micro investigation level, so where we looked at the premiums only, they did quite well. But when you look at the big picture and you include the big picture as well, their overall performance wasn't great, because their longevity, their health of the scheme didn't come out looking great, because they were unfortunately not able to attract enough younger members. So we would be more careful when we look at the smaller schemes going forward. This year we included 23 different 23 different medical aids, of which 22 were open plans and 1 was a closed scheme. We used ProfMed as the closed scheme because we are also in the private investment wealth creation field, and that means a lot of our individual clients are professionals in their own right and therefore have access to ProfMed. And when they look at us from a medical aid comparison point of view, please can you also include ProfMed? So from a GTC perspective, it works for us because we have this wealth investment team who has people within that profession or within the professional world, so we really have to include those. So when we have to look at these 144 different schemes and compare them with one another, with all of our knowledge, it's easy enough for us to say, out of these 144, they fit into one of 11 different categories. So we work with this every single day. It's easy enough for us to categorize any of those 144 into one of those 11 categories. But first you have to understand that there are all these different levels of categories which you need to consider. So do you want just an entry-level plan, which is for basic people who are just coming into the market? Or do you want a plan which is only for hospitals, like young single members would maybe want only a hospital plan? Would you like a small savings account? Would you like a medium-sized, a large savings account? Or would you like something that's unlimited, a comprehensive type of plan like a family would need? The man on the street has no idea where they fit in. They just know they have a medical aid and it's called a Fed Health or a Discovery something or other. I don't know which one I'm on. That's generally the response which you get, having to then go and get a whole investigation note, find out what they've got, and then only start the comparison process. So members really need to be more knowledgeable about which plan they're on, understand that, and then use our survey to find out if they're on a plan which is competitive enough, has a healthy base. What should they be looking at? Well, we as professional advisors would be able to help you to identify which one of those you're on. What we did in our survey was right in the beginning, we listed the different categories, all 11 of them, and we actually showed which medical aids fell within each of those 11 different categories. So making it easier for people to identify where they actually fit in the market, and then go and look at comparisons as well. Professional advice, professional advice, professional advice. You cannot use it in isolation. Always remembering that it's all very well knowing where you are and where you fit competitively, but it may not be the right fit for you. The plan may not provide dentistry and your child needs orthodontics, or enough dentistry, or enough out of hospital cover, or you may need something more comprehensive. Always professional advice, professional advice. I can't stress that enough. We as healthcare consultants earn a 3% commission of the premium which you pay as our ongoing servicing fee, and all open medical aids include that 3%. So given the fact that you're paying that 3%, it really would be advisable for you to make use of the professional advisor allocated to you. If you're not sure who that is, phone your medical aid and ask them. They will give you the name and contact number. You can contact them and discuss from there. So like we found in our survey this year, most people choose a plan and stick with it. Whether it's right or wrong, whether it has too many or too few benefits, they rarely review this and go and look for something else that's better or beneficial or provides the right benefits. In some cases, we have families who have full members, people who are on the adult basis level, paying for adult level premiums, where these children are actually adults, students. So they're studying, going to university every single day, and the parents are still paying a full premium for them to belong to the parents' plan, and in many cases on a classic comprehensive level, which is the most expensive, or one of the most expensive plans on a comprehensive level. So what we say to our companies is, you have the use, you are paying for the professional already, so make use of the professional. They will guide you and actually say, there are these 5 student plans available, and we list them in our survey this year. There are these 5 student plans available. Perhaps you should look at the premiums. You could save an immense amount of money. You will have limited access. These children are usually young and healthy anyway. You will have limited access to a network of hospitals and a network of doctors, but everything is provided. Best you look at downgrading so that you can save the premium. They can still have private level of hospital cover, but at a premium that's more affordable to you. And then maybe you can buy them the car, or celebrate the 21st, or a byproduct of our big data analysis this year, which we didn't do last year, is we actually found there was many different areas which we could consider and have a look at. So we found chronic illness benefits. X% of schemes that we analysed now provide cover over and above the prescribed minimum benefits. Some of them actually saying that they have unlimited amounts of cover. Same thing happened on oncology. We actually found that some plans, or many plans, offer above the level of prescribed minimum benefits, with some of them, and we've listed those, actually saying they provide unlimited oncology cover. Now, people who have cancer actually would need an unlimited oncology cover. Could you imagine doing that? And you could find out in our brochures this year which plans those are. So quite important. We also found, as a byproduct of our investigation, was preventative maintenance. Most plans offer this wellness program where they pay for flu vaccinations or pap smears or prostate checks, and the byproduct that we found was that so many of them are providing it this year, or on an ongoing basis, maybe not necessarily this year, but over the course of the last few years, they've been continually providing more and more from the wellness benefit rather than from your savings account, meaning that your savings is going to last longer. Things are going to get paid for out of risk rather than from your back pocket. People are then taking more care of themselves, being able to use this benefit which is being provided by the scheme. So for us, it's wonderful. It's no longer being used as a comparative tool. So we're no longer saying, well, this plan provides this extra and that plans provide that extra. It's now becoming the norm. So a lot of the benefits are becoming more used. Everybody's providing them now. What we do show in our report this year is what percentage of them are being provided by most of the schemes. So it's actually quite an interesting. So the statistics are shown right at the back of our brochure. I found them, to be even for somebody who works in the industry all the time, extremely interesting. So the first factor you should look at, and it's always the biggest factor, is what happens if I go into hospital? What level of cover is going to be provided? Now, I don't mean by the hospital. I do mean by the services that you're going to receive in the hospital. The oncologist that's going to be seeing you, or the surgeon who's going to do the operation, or the anaesthetist that's going to put you under. Those private practitioners can charge whatever they wish. If you're not seeing a network provider, so each of the medical aids have their own network provider. If you're seeing someone outside of the network, then you're going to be asked to pay whatever the rate is that this person is charging. So if your medical aid is a 100% plan, or a 200% plan, or a 300% plan, you're going to be limited to that level of cover provided by your medical aid. The rest is coming out of your back pocket. So we as GTC always promote you use a top-up cover. So we say, if we're going to sell you a medical aid, please buy the top-up cover, because I can guarantee there's going to be a gap, and who's going to be the one in trouble for selling you this 100% medical aid, where I explain very carefully it's 100% of the scheme cost, not 100% of what the guy's going to be charging you, ending up in a query that's coming through us. So please spend the extra 200 Rand on the top-up cover, then you will have an additional 500% worth of cover. So you will go up then to a 600 or a 700% plan. So for us, that's point number one. Point number one, look at the amount of cover you want from in-hospital. Number two, see if there's a network available. If there's a network in your area, you're happy with the hospitals that are near to you, please take the discount in premium and belong to the network plan rather, saving yourself further amount of money. Okay? And the last thing we have a look at is the amount of cover you want out of hospital. So do I need the medical aid to run a savings account for me, or can I run a savings account for myself? Do I want a savings account? Do I want a small savings account, a medium or a large savings account? Because there's saver plans that cover all of those different levels. And the last thing you look at is, do I need an unlimited out-of-hospital cover? So do I need a comprehensive plan, which has a savings, a small self-payment gap, and then an additional unlimited amount of cover? So if you need a comprehensive level. So those are the three things we would have a look at when we choose a medical aid. Please don't use the survey in isolation. It should always be used in conjunction with a professional healthcare consultant. So don't try to be a hero and do it by yourself. Don't try to be the HR manager and do it by yourself. Use your designated professional advisor to go through the results of the survey. Your professional advisor may survey or may find results different to our survey, analyzing different areas, but at least your guys then doing the work of a professional advisor and giving you their point of view, just as our survey gives our point of view. So we see it as such. We see that these are the important factors to be including from a macro point of view. We see these are the right categories to be defined and used from a micro point of view, and this is what our combination reveals. So don't use it in isolation, please. It's the wrong thing to do. Use it with a professional advisor. That way you'll get the best out of the survey.